Hello, my name is JThomas. I am an education policy nurse working at the Canadian Association of Schools of Nursing, and today I'll be sharing with you a project that is being conducted by CASN on climate-driven infectious diseases for undergraduate nursing curricula. I'd like to take a moment to acknowledge the expertise, the time, the contributions of all those who have engaged in this project for the development of the education guidelines and the accompanying e-resource, which I will speak to more in the presentation. A special thanks to the multiple stakeholders across Canada listed here who provided and continue to provide their feedback and expertise. We are especially grateful for the patient advocates and committee members representing those with lived experience, as well as, in particular, the guidance and oversight of the Canadian Indigenous Nursing Association in planning and implementing the Indigenous consultations for this project. In 2018, CASN received funding from the Public Health Agency of Canada to conduct this project through their infectious disease and climate change fund. I'm just going to provide you a quick overview of our project now. The project is titled Empowering the Next Generation of Healthcare Professionals with Knowledge, Skills, Tools, and Supports to Address Infectious Diseases Related to Climate Change in Canada. It has been carried out over the course of 30 months and will conclude in March 2021. And as mentioned, it's been made possible by funding from FAC. The goal of this project is to increase the knowledge of the effects of climate-driven infectious diseases on population health amongst nurse educators in Canada, and to foster the integration of this knowledge into Canadian nursing education programs to ultimately enhance the capacity of the next generation of nurses in addressing climate-driven and vector-borne disease. The target audience for this project are the schools of nursing in Canada that offer baccalaureate and graduate nursing programs in English and French, and secondary audience to that are nurses in practice, as well as all other health professionals in the workforce. To achieve the project goal, the following activities are being carried out. The first deliverable for this project was to develop national evidence-informed consensus-based guidelines for nursing education. This guideline has actually been completed, and I'll speak to it shortly in the presentation. And now we are currently working on the accompanying e-resource, which will facilitate and foster the integration of the health effects of climate change infectious diseases in schools of nursing across Canada. The Climate-Driven Infectious Disease Project Committee, Advisory Committee, is a group of dedicated experts in infectious disease and nursing that develop the domains and learning outcomes delineated in the guidelines. And you can see we have broad representation from schools of nursing across Canada, the Canadian Nurses Association, Association of Medical Microbiology and Infectious Disease, from FAC, persons with lived experience, the Canadian Indigenous Nurses Association, and so on. Now, just a few highlights from the literature that we did a review at the beginning of this project and have been collecting literature over the course of the project. We know that climate changes have been increasing across Canada, as evidenced by flooding and wildfires and higher surface temperatures, and this has increased the health effects associated with climate change for those living in Canada, in particular increased risk for tick-borne diseases, endemic and exotic mosquito-borne diseases, as well as foodborne diseases. One key nursing role related to this area is surveillance, and you can see what that entails here, as well as prevention for nurses. And in fact, we do have entry to practice competencies that are required by all nurses on graduation, in particular when looking at the role of the registered nurse as a clinician and as an advocate. And I would like to also highlight that in 2014, we did receive funding from FAC again to develop entry to practice competencies for public health nursing. And so you can find that publication on the CASN website as well. So nurses play a key role in the area of climate change, as you can see here in terms of how we can address and respond to climate change. But that being said, nurses and nurse educators do need greater awareness of these issues, as well as more evidence-based knowledge to guide patients. And so we need increased nursing competence in this area. The timeline for this project, as you can see, we have been working since 2018, starting with the establishment of an advisory committee in September 2018. We conducted a gray literature scoping review, which helped the advisory committee develop preliminary draft learning outcomes that were reviewed by a national forum of stakeholders in May 2019, and then again by an Indigenous panel, and then it went out to after various revisions based on this feedback to all stakeholders through an online validation survey, and we finally published in March 2020. So in terms of the education guidelines, these are national consensus based. They provide recommendations informed by evidence on content pertaining to a particular topic. They are informed by evidence and by experts in this specified area, and they specify learning outcomes and or knowledge, skills, and attitudes in this area. Their purpose is ultimately to provide guidance to nursing faculty on curriculum development related to the specific topic. And so this is what the guidelines looks like. It is available currently on the CASN website. You can download it there. The document is organized into 5 domains. The first one being public health, vector-borne infectious diseases. Domain 2, populations exposed to potential risk. 3, prevention, primary and secondary. Domain 4, treatment and tertiary prevention. Domain 5, advocacy, and there are detailed learning outcomes and indicators that accompany each, 34 in total. So now I'll speak to the climate-driven infectious diseases e-resource. I'd like to acknowledge the e-resource development team, Michael Foley, our web designer from Pixelara, as well as the 4 content experts, June, Andrea, Morgan, and Shannon, who are also educators that have developed the content for the e-resource. The target audience for this e-resource are faculty, students in entry-level nursing programs. It is an open access resource, and there are no prerequisites required for any learner going in to access these modules online. It is designed as a toolkit to support current and future nurses, and ultimately it is intended to address content related to knowledge and skills that are required of those working with individuals and populations facing climate-driven vector-borne disease. This is just a snapshot of the e-resource site that is still in development. And just to mention that the content has been organized into 5 modules that address the learning outcomes in the CASN guidelines. And there are 37 learning outcomes across these modules. And each module is meant to represent each of the guideline domains, with domain 2 and 3 being combined into 1 module, and it opens with an introductory module overviewing climate change to set the stage. We've been working really hard to ensure that the format is dynamic and user-friendly. It's standardized. It is supported by interactive and dynamic learning tools such as case studies and quizzes. And we figure that each module will take about 2 hours to complete. The online modules have a standardized structure. So each one has a number, a title, a description, and time to complete indicated at the start. It opens with learning outcomes, the guideline principles and key concepts, as well as an introduction. And then content related to each of the learning outcomes is then presented with critical thinking questions and learning exercises. And then each module ends with a summary and a brief note on what to expect in the next module. There are references and additional resources associated with each of the modules so that learners can have the opportunity for further study. As you can see here, Module 1 overviews the science behind climate change, as well as traditional knowledge related to climate change and the impact of this on vector-borne diseases. Module 2 is an overview of vector-borne diseases in Canada. The focus is really Lyme disease and West Nile virus for the e-resource. Module 3's focus is on risks and protective factors for vector-borne diseases, as well as primary preventative strategies. And Module 4 provides an in-depth overview of the diagnosis and treatment of Lyme disease and West Nile virus. And finally, Module 5 focuses on the importance of awareness and advocacy in promoting best practices and quality of care for people living with vector-borne diseases. Evaluation, within each module, we have included a self-assessment quiz, as well as critical thinking questions throughout. And at the end of each module, learners will have the opportunity to monitor their own understanding and teach new content or apply content through case studies through these questions. You will see that we have been moving along quite swiftly in our timeline. We started in January 2020. We developed draft content. It's been reviewed by stakeholders as well as Indigenous experts, those with lived experience, and gender experts. And we are at the process now where we have been fortunate to keep track despite of the pandemic. We're finalizing content. It will be translated into French as well, so it's available in both languages, and we'll be testing over the fall so that we can officially launch in March 2021. And I encourage you to visit us on our website or contact me to learn more about this project, or if you have questions. Thank you so much for taking the time to listen to the presentation.